Now we start scanning from epigastrium by using the linear probe and placing a probe at epigastrium area in transverse position. Here we see the duodenum and food particles and gases in the duodenum. Here we see the echogenic lining with shadows. These are gas. These appears due to gases in the small intestine. Now we slide the probe from epigastrium to the pubis or lower abdomen to scan the small gut loops. When the small intestines are normal, the gas shadows are present and the walls of gut loops are not appreciated or not visualized. Here we see the transverse colon, which commonly lies above the umbilicus, and it is large in size in diameter as compared to the small intestines. Here we see the food particles are moving in the transverse colon. Here we see the increased peristalsis in the pelvis or in sigmoid colon. The food particles with fluid are moving rapidly. Now we moving the probe from pelvis to the right iliac fossa and following the small intestine. Here we see echogenic line, which is gases in small intestine with shadows. Now here we see a hypoechoic area with gas shadows in the right iliac fossa. It continues as dark line and below there is echogenic line. This is the wall of ascending colon, or echogenic linings are gas bubbles. In large gut, the gases are appears as bubbles due to hasturas, and in small intestines, gases are appears as thin echogenic line. So you can differentiate which is small intestine and which is large intestine due to gas shadows. Now we see a heterogeneous area in the wall of muscles layer of ascending colon. When the walls of gut loops are inflamed, the muscles layer of gut loops appears as hypoechoic line. and prominent. Normally they are not seen. So here we see the wall are inflamed and thickened and hypoechoic. Mostly this is muscular propria layer of the cut loop. This is transverse view of ascending colon or cross-section view, where we see the walls of cut loop, anterior, posterior, lateral and medial side. And here we see the anterior wall is thickened as compared to other walls. The anterior wall is thickened and shows heterogeneous texture, a hypoechoic and isoechoic texture, and also an echogenic area between the hypoechoic layer. On color Doppler, we see no flow at this area. The surrounding tissues are also echogenic, which normally occurs in inflammation. Now we will take the size and volume of this abnormal area or pathological area. This is transverse view and we will take transverse measurement. And when we rotate probe at its axis to take oblique view, and then we will take also a cross section view and measurements to take the volume of this heterogeneous area. Now here we see the size and volume of this area. The size is 16 into 20 into 20 millimeter equal to 4.1 milliliter volume. Now here we see well-defined rounded masses in the soft tissues. These are lymph nodes. Now we slides probe from ascending colon to upside to the right hypochondrium. Here we see the gut loop is normal and shows normal texture. No walls are appreciated. And this is transverse colon. Now we slide from right hypochondrium to the left hypochondrium to see the transverse colon, which appears normal. And this is descending colon, which also appears normal. Walls are not prominent, gas shadows present. And this is sigmoid part of colon, which contain fluid and food particles. Now how we will write report. The walls of proximal part of ascending colon inflamed and a heterogeneous area or collection measuring size 18.6 into 20.9 into 20 mm having volume 4.7 milliliter present in the anterior wall of muscular propria layer, which is also spread in the surrounding tissues. The surrounding tissues are also echogenic and edematous. Lymph nodes are also mildly enlarged in size in the surrounding tissues. The middle and distal part of ascending colon and transverse colon, descending and sigmoid colons are normal. The small intestine are also normal but shows increased gas shadows. The ultrasound diagnosis is interior colitis with abscess collection in the anterior muscle layers of proximal part of ascending colon.